Hello, I am Melissa Galloway, a student at American Sentinel School of Nursing at Post University. This presentation is of the Capstone Project Proposal, Part 1, Submission for SIM 499, Reflection of Practice Analysis. In this component, we are asked to identify the Capstone Project Proposal topic by giving an in-depth explanation of the chosen capstone project in detail and explain the importance of the project. Next, we need to identify how the project will impact my own personal profession by stating at least 5 ways it will impact my personal profession. Lastly, we are to discuss how the project will impact the profession as a whole by identifying a minimum of 5 ways the project will impact the profession of nursing. Identify the Capstone Project Proposal topic. The Capstone Project Proposal topic I am submitting for review is the reduction of hospitalizations of diabetic patients with better education of self-management of diabetes by the nurse case manager. Clients are educated by their physician once they are diagnosed with diabetes on lifestyle changes that will assist in management of the disease process, such as proper nutrition and physical activity. Clients have little success with diet and exercise alone, and most require medications to assist with the management of the blood glucose levels, and that's Capstone and 1, 2018. Medications to treat diabetes are complicated in their actions, and clients need more education on how these medications affect them. Clients with diabetes require a high utilization of primary care visits, emergency room visits, and intensive care visits for hypoglycemia. It's estimated that 25% of clients with diabetes that visit the emergency room is due to hypoglycemia, and that's Capstone and 1, 2018. Receiving one-on-one education with a nurse case manager through a series of diabetes management using the teach-back method, including a demonstration by the patient in the use of the glucometer in the first visit, as well as medication administration demonstration in the first visit, whether the medication be by mouth or injection. Identify how the project will impact my personal practice. 1. The project will impact my personal practice by reducing the rehospitalization rate for clients with diabetes at my home health agency. The Centers for Medicare and Medicaid publicly reports home health agencies' hospital readmission rate and includes the results as part of the calculation to assign a star rating to the agency. Star ratings are viewed by potential referral sources, clients, and their caregivers when choosing a home care agency. Readmissions to the hospital that are avoidable associate the agency with poor quality or ineffective services, and that's Smith et al., 2019. Second, this project will improve relationships with collaborative partners that are affected by lower rehospitalization rates, such as the hospital, physicians, and patients. Hospitals are affected by lower reimbursement for readmissions of clients with a few select diagnoses. While diabetes is not one of them, they view the overall readmission rate as important. Thirdly, this project will lower cost at my agency as the direct care cost per visit is impacted by longer visits post-hospitalization. It will also lower cost as with less complications, clients will need less and less visits. Fourth, this project will improve our patient satisfaction or experience ratings. Clients expect to be able to remain at home once they are discharged from the hospital and will often see the rehospitalization as a failure of the agency without regard to the root cause of the rehospitalization. Fifth, this project will improve client outcomes and reduce their risk of complications associated with diabetes. Identify how the project will impact the nursing profession. 1. This project will reduce rehospitalizations for clients with diabetes. In the research of 1,949 patients who had a hemoglobin A1C of greater than 8 who received intensified diabetes management training, had a 77% lower chance of being readmitted to the hospital within 30 days and had a reduction in their hemoglobin A1C by 1.8%. And that's Rubin 2018. Second, this project will lower the mortality rate for clients with diabetes. Third, this project will promote patients' self-management of the disease process of diabetes. In one study, a group of people were given a readmission survey to learn the patient's perception of why they were readmitted to the hospital, and 4.5% of the people reported not understanding how to take their medications. 7.4% reported having trouble understanding what they were to do to take care of themselves, and another 39% reported needing more assistance to stay well outside of the hospital. And that's Carter et al. 2020. 4. This project will improve the public's perception of nursing as educators to lower clients' risk of complications with diabetes. 5th, this project will improve the delivery of patient education related to management of diabetes. Thank you for considering this proposal to improve education to diabetic patients to reduce costly rehospitalizations, improve patient outcomes, and improve the overall quality of life of diabetic patients. Thank you.